Good evening and a delightful welcome to Medical Mondays with Dr. O. I am your host, Gustav Ajay. Medical Mondays bring you an intriguing chat on health, medical information, and possible solutions as we discuss health issues to help us live a healthy lifestyle. Audience, your questions are very much welcome. Kindly drop them in the chat box or raise your hand digitally, and you will be recognized to ask your questions. Today's topic is the power of prevention with Dr. Toyin Opesanmi, popularly known as Dr. O. She is a family practitioner, HIV specialist who also treats addiction. She is in private practice, CEO and medical director at Janassaret Medical Center, as well as medical director at Global Vision Foundation and the Global Vision Community Health Center. She works hard at bridging health disparities through her clinical health fairs and medical missions internationally. Relax, please mute your microphones if you are not speaking, and let's have an engaging conversation about our health. Welcome, Dr. O.
Thank you so much. Really appreciate you, Honorable Gustav Ajay. It's an honor to have you this evening to host Medical Mondays. Honorable Gustav is it's a huge name in Ghana. We're going to talk today about the power of prevention. It is very important to know what we need to do at each stage of our life. We can actually prevent a lot of disease entities because once we allow them to occur, then we have to start scrambling on treating, sometimes just palliating things, so to say. The power of prevention is what will give us strong health and a strong future. In preparing this talk, I decided I'm going to start from the very beginning, from birth. So when a baby is born, what happens? The medical personnel looks at the baby's alertness, the skin, reflexes, hip stability, the weight compared to the height, hearing tests are done, and all whatnot. The pediatrician would like to see that infant within a week of delivery, just to make sure things are going well. And of course, diet is decided if the baby would be breastfed or bottle fed. We advocate breastfeeding in medicine. Breastfeeding is the 100% perfect way to feed a baby. It confers immunity to the baby. It's just the way to go. Then immunization starts before the baby is discharged from the hospital. They get their first shot of hepatitis B. And in a month to 2 months, they follow up with the second shot, and a series of shots, which we call vaccines, would follow 2 months, 4 months, 6 months, 9 months, 12 months, and the list goes on. We screen at some point for the autism spectrum disorder. We screen for anemia, lead, TB, and then children grow fast. We get to the pre-adolescent stage where babies need to be seen or children need to be seen yearly. And what do? We compare weight to height, which we call the body mass index, to see if these children are growing well. And in our society, in the United States, to see and make sure that they're not obese. Obesity has become the order of the day in the United States. It's become a disease entity. And we're seeing a lot of it in children. And so it confers disease entities to children from that early age. We try to educate on diet and exercise. We do blood work. to screen for lead, anemia, like I mentioned before. We look at milestones. Children should attain certain milestones at certain ages. And, we also do immunizations, catch up on some if they have missed some before they get to the pre-adolescent ages. Influenza vaccine, we give every year. Actually, pregnant women also, we make sure they get influenza vaccine. And dental exam is very important from this babyhood. I've seen babies in my practice whose teeth are just what I call rotten because of poor feeding, sweet things, not cleaning the teeth morning and night, before bedtime, allowing bacteria that lodges in the mouth at night for any age to continue to brew in there instead of brushing them away before bedtime. So we educate on these things when children come to clinic. If they don't come, we don't have the opportunity to educate. Then we get to the adolescent ages. I purposely put 12 to 18. Some people think 13 to 18. But in medicine, adolescent starts at 12 in our minds. So again, yearly physicals are important, and we do all similar things. We educate on hours in front of computers. It leads to obesity when children are sedentary, not getting up to exercise, not getting up to do, things that, not getting up to work those muscles and work the fat away and just eating. They pile it up, and if one is not careful, in 2021, it's become a problem. So we advise that parents limit the hours of children in front of computers. Hygiene is important. This is, the time, you teach that. Dental care, again, is very important. Building children's self-images. Believe me, when you bring your children to us and we're asking all those questions about, do you have friends? Do you like school? What subjects do you like? Is anyone picking on you? Do your friends smoke? Do they drink alcohol? Do they use drugs? Stuff like that. Are they having sex yet? There are reasons why we're doing that. Because if the friends are doing it, chances are the children too are doing it. But I want to advocate here on this forum today that you should start this screenings at home. Have a relationship with children where you have open line of communication. When my children were growing up, we talk about everything during meal times. It's incredible. And you know what? It paid off, because I remembered when my younger son was in university, when he called me one day and asked me to please come on campus. And I said, why, when? He said, now. I said, okay. I dropped everything, quickly rounded up at work and went straight on campus. When I got there, he had a group of his friends just streaming into his room to come have me talk about sex. He has been telling them about how to be safe, really abstaining, and they were not listening. So he felt somebody who has medical prowess, who treats this, sees this, should come talk about it. But guess what? That started from dinner table. It's the conversations that we were having at home that led to that made him so confident that I have the right answers. And the answers that peers were giving, he didn't think were right. Peer pressure is very important during this age. If you don't develop that relationship with your children so that they can come to you and they learn firsthand what is true and real, they're going to believe what they hear out there amongst their peers. During this age group, children prefer their friends to parents. They want to be out there with friends. They want to hang out. But again, foundation is very important and it's part of prevention. So it's very important that we connect with our children. We give immunizations. I listed some here. And HPV, I wanted to talk about HPV, human papillomavirus vaccine. You know, I had a patient of mine come in and I recommended the human papillomavirus vaccine, a Nigerian woman. You know what she told me? Oh no, that's giving license to my daughter to have sex. I don't want her to have it. So I had to educate her that human papillomavirus is a virus that one contracts through sex. And it leads to cervical cancer. That is really what we do pap smears for, to screen for cervical cancer. And if your daughter is a virgin, gets married, you don't know how many people the husband has been with. And so she's with everybody the husband has been with. So why don't you protect the girl from human papillomavirus earlier on? I explained that in similar words and she got it. She said she was going to educate other women in church because they got it wrong. They thought it was licensed for, you know, girls and boys to start having sex. No, we give human papillomavirus vaccine starting age 11. If they get it before age 14, then they will get 2 series. If they wait till 15, they will get 3 series. It doesn't matter. It's important for children to get this, to get protected, because you never know where they may end up. Young adults, still same thing, have to do yearly physicals, get needful vaccines. Tetanus, diphtheria, and pertussis vaccines are given every 10 years. Meningococcal vaccine, we now, you know, advocate that people should get. If they have not gotten varicella vaccine, we give it. And now the standards for pap smear had changed. Before, we start pap smear at the age of 18 or at the age that a child starts having sex. Now, we don't. Standards changed that pap smears should be started at the age of 21. So we start at 21, and I will go further and explain more about pap smear in a minute. Dental care is important. Make those dental visits. It's important to prevent than to start treating disease entities. Dental issues has been linked to cardiac problems, heart problems. So it is very important that we do those dental visits. Once a year, once you see the dentist, if you need to see the dentist more, the dentist will let you know. Same with us in primary care, internal medicine. If you need to make more visits or do more visits, you will be canceled that way. And we do also appropriate labs. So pap smear, like I said, now we start at age 21. 21 years to 29, we just do the pap smear. But 30 to 65, we add the human papillomavirus screening. 65 plus, if they've had negative prior pap smears, 3 consecutive negatives, then they don't need to screen anymore. But if they have high-grade lesions, then they need to continue screening. So it's individualized. Pap smear is individualized after age 65. When a woman has had hysterectomy and have the cervix portion removed along with it, there's no need for them to have screenings again, unless they have history of high-grade precancerous cells, that is the human papillomavirus cells, or if they have had cervical cancer. So this now takes me to breast screening. Breast screening, we are schizophrenic about it. Every college have different take on breast screening. the US Preventive Services Task Force, and my academy, American Academy of Family Practice, always say the same things. We follow the US Preventive Services Task Force. And they said the decision should be individualized. That women who place a higher belief, so to say, on the potential benefits than potential harms may choose to begin screening once every 2 years at the age of 40. American Cancer Society says women should be screened starting 40 to 44, and they choose to screen every year. I will not belabor this. All I'll tell you is that different colleges have different opinions. Some say screening should start at 40. Some say it should start at 45. Some say it should be yearly. Some say it should be every other year. So every woman has to have this discussion with their physician. However, I want to draw your attention to the American College of Physicians that says clinicians should discuss whether to screen for breast cancer, whether to screen for breast cancer, and I'm sorry, I think the screen has changed. With mammogram before age 50. They said discussion should include the potential benefits and harms and a woman's preference. The potential harms, they say, outweigh the benefits in most women age 40 to 49. And I'll speak English there. The American College of Physicians is saying that it is not beneficial to start screening before age 50. They are asking that women start breast cancer screening at age 50, saying that the potential harm outweighs the benefit. The International Agency for Research on Cancer says there is limited evidence that screening with mammography reduces breast cancer mortality in women ages 40 to 49. Again, they are calling for screening to start at the age of 50. So why is there all these discrepancies, and why are different colleges suggesting different things? 50 to 74, the US Preventive Services Task Force suggests that screening with mammogram should be done every 2 years. American Cancer Society recommends once every 2 years. But guess what? ACOG says you should do it once a year or once every 2 years. And the College of Radiology say you should do it every year. American College of Physicians said it should be done once every 2 years. The International Agency for Research on Cancer says there is sufficient evidence that screening with mammography reduces breast cancer mortality in this age group, that's 50 to 74, to an extent that its benefits substantially outweighs the risk of radiation-induced cancer from mammography. And then they said there is inadequate evidence that clinical breast exam reduces breast cancer mortality. There is sufficient evidence that clinical breast exam shifts the stage distribution of tumors detected toward a lower stage. Now, what are they saying? They said 3 things there. They addressed 3 issues. The issue of screening women between ages 50 to 74. Remember, they don't approve women screening before age 50. But 50 to 74, they said there is evidence that it should be done. And that the radiation-induced cancer, because that's possible too, with mammogram, does not outweigh the benefit of screening. They also said that it should not, breast exams are not beneficial. It doesn't decrease the mortality or, help in finding cancers. That has been my personal experience in practice. Most patients that have diagnosed with breast cancer come to me telling me that they found a lump in their breast. They do their own self-exams. So it is important that you do your own breast exams once a month. They do their own breast self-exam and they find that there's a difference. You will know your body and you will know when something is different. They find that there's a difference, and so they come in to get it evaluated. And that's how we usually diagnose. They also said the third thing, that when you do those breast exams, then the cancer is caught on time. And the stage that the cancer is caught is at a lesser stage, which is better, beneficial than if it has advanced. So I'm switching gears to present some cases to you. RJ was a 55-year-old African-American patient of mine with high blood pressure, diabetes, and high cholesterol. She was very compliant with her medications. She kept her clinic visits, and during a yearly physical exam, which is when I usually will recommend this, screenings that are needed at the appropriate age, I suggested that she gets mammogram done. Did the referral, mammogram, pap smear, and colonoscopy. She did not do any of them. But on one of her visits, I switched the visits to do a pap smear, and we got that done. She never did the colonoscopy, and one day she presented to the clinic at the age of 61, said she was bending down to pick something up in a drawer, and she heard a snap in her back. She couldn't sit. Her husband was the one who carried her back to the clinic that day. I knew there was a problem. Unprovoked fracture is a problem. So I sent her for imaging, and lo and behold, she had metastatic cancer. That is cancer that has spread to the spine, to the back. The cause of the cancer was from the colon. I went back to my chart and I saw that every visit, I begged her to go do a colonoscopy. She never did it, and she didn't make it. Chemo and all, she passed, she died. Another patient of mine, TJ, African-American man, I met him 7 years ago at the age of 50. He adamantly refused to get colonoscopy done. I explained the procedure. You'll be sleeping. You don't feel it. You don't know. The only thing about colonoscopy is the prep time. You're going to get laxatives and you're going to poop all night to clear your bowel so that the screening can be a good and clear one. He refused. Then Cologuard came. Cologuard is a screening test that the company sends to the patient's house. The patient will collect their stool, send it to the company, and they use the DNA to see if there's cancer in that person's system, if they have colon cancer. And we did. He agreed to do that, but I made him promise me that if it's positive, then he would do colonoscopy, and he agreed to do that. Cologuard came back, he was positive. He was a honorable man, kept his word, did the colonoscopy. This man had polyps in every segment of his colon. I've never seen that in my practice. Normally, when there are polyps that are removed during colonoscopy, the patient is told to return in 3 years or 5 years for follow-up colonoscopy. In his case, he was told to return in a year. He's been doing yearly colonoscopy because they kept finding polyps. And when the polyps were sent for pathology, guess what? Many of them were cancerous. So he was saved because he did the colonoscopy. The beauty of colonoscopy is that once you're screened, if you have polyps, it's removed right there and then, and it's a cure. So there's no reason for us to be, running away from screening. Again, in colonoscopy, there are different colleges and different thoughts, but I'll summarize it for you. And I noticed that men have talked longer than I asked my speakers to talk. I'm always excited to talk about prevention. So humor me for a few more minutes. Because of the increased risk, or not risk, increased incidence of colon cancer, it is now recommended that screening be started at the age of 45. Unless there is family history that dictates otherwise. If somebody has first-degree relatives, say mom, dad, brother, sister, that has colon cancer, and they had the colon cancer, say at age 50, just example, then we will start colon cancer screening on patients like that at the age of 40, 10 years before, because it usually takes 10 years for the polyps to mature to cancer. So there are other screening tests also, but a lot of them are now old-fashioned. Why would I do sigmoidoscopy, look just at the sigmoid, when I can do colonoscopy and look at all the colon? So I just put that screen there to let you know that there are other, tests that can be done. Prostate screening, the standards has changed also. Before, oh my gosh, I cannot tell how many rectums I've stuck my finger in. We're told we don't have to do that again. And PSAs that we draw, the prostate-specific antigen that we draw in the lab work to see if somebody has cancer, it is recommended that we don't do it anymore unless the patient requests it. If they want it, then we'll do it. Why is that? Because there has been overdiagnosis that has led to over biopsies, and then has led to procedures that are not, that should not be done sometimes. And these procedures are not risk-free. Sometimes the possible complications of erectile dysfunction, incontinence, and stuff like that occur. And that is why the standards have changed. But if you want to get it done, you want to be sure, ask your primary care doctor. Standards is they will do it. For men aged 70 years and older, it is recommended that, screening do not outweigh the harms, and, the prostate cancer screening should not be done. So there, strong health, strong future. Screening is always the way to go, instead of waiting to actually be diagnosed or wait to get a disease entity. Thank you so much for listening tonight. And we will go to our question and answer session.
Thank you so much, Dr. O, for that insightful presentation. And we are so grateful for the knowledge shared. It's time for your questions and comments to be addressed. Keep them coming through the chat box, or you can raise your hand electronically, and then we will get your questions answered. Remember, if you're live on Facebook, you can send your questions as well. Please subscribe to our Medical Mondays channel on YouTube. It's Medical Mondays with Dr. O, and be sure to hit the notification bell on the page. You'll be notified for future shows and can join us with a click of a button. Let's go to the questions. And we have one saying, Dr. O, what is the efficacy rate of HPV based on human trials, as it has not had a long standing on the market as of yet?
Thank you. Excellent question. It is actually very efficacious. We screen for HPV by pap smear. We do the cervical smear, and in men who have sex with men, we do rectal pap smears to screen for HPV. And when we screen, the screening tests are, they're fantastic. They would break things down into the risk. Is it, low-grade squamous cells, or is it high-grade lesions? And so it breaks it down. It's actually very efficacious, and it's been around for a long time. If you think of how long pap smear has been around, that's long it has been that we have been screening for HPV. Dr. Ajagbe has, Dr. Ajagbe has a comment. And Dr. Ajagbe, sir, if you will please unmute. He called in from Nigeria, or is zooming in from Nigeria. He has a comment on breastfeeding and dental care. Dr. Ajagbe, are you still on, sir? Okay, network has been bad where he is. Again, it's in Nigeria. So we'll see if he can make it back, and then he would give us his input. Back to you, Honorable Gustav.
All right. As we wait for him, there's another comment from Madam Lara. Says, great presentation, Dr. O, as usual. The value of screening cannot be overstressed. And I have a question. Most guys or men are always, skeptical about prostate screening. What words of encouragement will you, give them? I mean, to start as early as possible.
Thank you. Excellent question. Again, it's always best to screen and find disease entities before they actually become a problem. Men especially don't even like to go to the doctors. Most men, it's their wives that schedule their doctor's appointment, and if the wife is not sitting there with them, what they came for, they won't say. When couples come to my clinic and the wife is sitting back, I say, oh no, girlfriend, come on in. Because she's the one who will say, hey, this is why we came. He didn't say anything. I encourage our men to please, you are the head of our households, and we want you to live a long, beautiful life. Prostate cancer is a devourer. It's devastating when it does occur and it is not caught on time. When it is caught on time, there are different modalities now that can be utilized to treat it. If it's caught late, it's most likely surgery that has to be done. And, I told you about the erectile dysfunction, incontinence, and stuff like that. That can then occur. I recommend the PSA testing. Get it done and let the urologist make decisions as to what the next steps will be. Sometimes they just recommend we should continue to screen and see if the levels continue to increase or what have you. So screening is always important. And men, please do all those screening tests, not just the PSA, the colonoscopy, the lab work, checking your cholesterol. When I kept saying labs, I didn't go into the details of it. I'm surprised that nobody has asked questions on, those breast cancer screening that is so mind-boggling that everybody's schizophrenic about, the lab work that needs to be done. There are basic labs that we do, and they're very important. Checking the blood sugar, the cholesterol, the electrolytes, things that make the body run well: sodium, potassium, calcium, chloride, alkaline phosphatase, protein, albumin, urine. We check the urine for infection. Do you know that when people have urinary tract infection and it's not diagnosed, it goes all up, and then they can get septic and actually die from that simple thing that we can treat with simple antibiotics for 3 to 5 days and clear. But if we don't screen, we don't know. We screen for sexually transmitted diseases. People can have HIV for 20 years, syphilis for 20 years and don't know. You know, syphilis is very interesting. Somebody has syphilis, they have what we call a chancre. That is just a sore that is non-painful. And they may look at it in the genital area and say, what is this? It's not painful, and without any treatment, it goes away. Within a week to 2 weeks, it disappears. If they don't go see a physician who can test them and rule out syphilis. Guess what? In about 2 months or so, they may get a rash. Syphilitic rash in the past involves the palms, and it's a telltale sign. When somebody has rash in the palms, you know, there's only one other thing that we know does that, Rocky Mountain spotted fever. But I have seen differences. With time, things are just changing, even disease entities. I've seen people who have rash on other parts of their body, but may just have one spot in the hand that would not cue you into syphilitic rash. And then syphilis lies dormant, and it can be there for the next 20 years. When they now develop neurosyphilis, and then all hell breaks loose. Then we cannot really intervene to save that person anymore. They have mental health issues. There are so many things that can then occur. Women can have gonorrhea, chlamydia, that will block the tubes, the fallopian tubes. And if they're still in childbearing ages, they just know that they cannot get pregnant. They cannot, they can have children, and they don't know why. When they screened, they say that their tubes are blocked, and it's because of gonorrhea or chlamydia that could have been cleared with simple antibiotics if they were treated. You know, what about hepatitis B and C that can potentially, eventually lead to liver cancer? That's a death sentence. If you're not screened, then you don't know. In our setting, we screen for everything. When you go to your doctors, tell your doctor to check all of these labs. There are more, but I'm going to stop there.
Thank you so much, and keep your comments and your questions coming. One from Ashby says, thank you, Dr. O, for highlighting an important topic. Preventable cancers are still plaguing our communities. I have to agree, screening is low in communities where medical trust is low. So we have a lot of work to do as doctors in regaining community trust. I have another question. What are the chances of someone who has had a UTI? What are the chances of developing cancer?
Not from UTI. People don't get cancer from UTI. It's an infection, and it can, spread up into the kidneys. They can become septic and that, but they won't get cancer from UTI. And I want to welcome Dr. Ashby from Florida. Thank you so much for that excellent question. Dr. Ashby and I were on the phone yesterday for over 2 hours. She taught me a lot. I cannot wait for when she comes on Medical Mondays. Stay tuned, folks. All these things we're talking about can be cured with food. I learned, and I still have so much to learn. Look, Medical Mondays is teaching me, just like it's teaching you too. So, Dr. Ashby, if you please say a word, I'll appreciate it. Kindly unmute. It was a pleasure meeting you yesterday. And I thank my sister who introduced us yesterday. I'm going to call her on in a minute. Please say something.
It's so good to be here and join you. You look beautiful, by the way. And thank you so much.
You. Thank you.
Prevention, we often refer to all of our immunizations and cancer screenings as prevention in the conventional world, and it still is, and it's so important because so many preventable cancers can be prevented. And when I think about prevention, I think about preventing the lifestyle that leads to those cancers beginning, and sometimes being caught by the mammograms and the colonoscopy. So I'm very thankful for every step of the path that catches something that's pathologic. But I'm happy to participate tonight, and thank you for inviting me.
Thank you so much. And Dr. Benedicta, I'm going to ask you to unmute. She's the connector, amazing physician herself. Are you there? Kindly unmute. Okay, we'll go on. When she's able to unmute, we'll revert back to her.
Yeah, whilst we wait on that, there's a question from Daisy Jones. What are the chances of developing a cancer from gastritis?
Gastritis is an inflammation of the stomach. It does not cause cancer. And thank you so much for that question, my darling sis Daisy. It does not cause cancer. However, reflux is a different story. When people have reflux and it is not controlled, and you know what? A lot of people with big tummy. Do you know that that big tummy has a name in medicine? It's so important that it has its own name. It's called truncal obesity. It is not an evidence of good living or riches. It's evidence of disease now. So when people have that big tummy, it can, cause reflux by flipping the flap. A sphincter is called the pyloric sphincter that, opens up when food goes down through the esophagus into the stomach. It makes it open a little bit because the tummy is pushing it up. And so hydrochloric acid, which we have a little bit of it in the stomach to digest protein, flips into the chest. And guess what happens? After a while, that can lead to a certain kind of cancer in that area.
Let me pick a quick comment. Opeyemi Adewale says, the habit of drinking water seems to decrease with age. Doctors need to emphasize water therapy as part of healthy habituals.
Okay, I'm going to defer this to Dr. Ashby. I love that question. And you know what? I totally agree. We should drink water. Dr. Ashby, are you there, please? Because that's what she does in lifestyle.
Yes, I'm there.
Did you hear the question?
Yes. Well, I'm glad that somebody else noticed. As people get older, I do agree. Some who aren't used to having the habit of drinking 8 glasses of water a day, they drink less and less. Dehydration is common, and the tea and toast diet is very common as well. Sometimes when you're drinking tea, it might be caffeinated. You might be drinking the coffee, it's also caffeinated. And with that, there's a little bit of dehydration that happens because the tea caffeine and the coffee caffeine have a little bit of a diuretic effect. And so many people in their old age have chronic constipation, and dehydration is part of that problem. So agreed, we should emphasize water. Even if in the younger individuals, if you get a special scales that give you your body composition, you can tell your body water percentage. It should be between 60 and 75%, and most people are about 40 to 45%. So keep your water. It helps keep the cells refreshed and, of course, hydrated.
Thank you. Thank you.
There's another question that says, can you talk about Streps and the impact on kidneys.
Strep. Demi, my daughter asked that question. Can you elaborate more by what you mean by strep? Is it the strep infection? Demi, I'm looking for you. So can you unmute?
Yes, I was talking about strep infection, just to clarify if it can actually lead to a negative impact on the kidneys.
Actually, no, I've not seen a connection with that yet.
Thank you.
Thank you. Thank you for the question.
Andrea Harrison says, I'm reading a book on the issues of inflammation. As a kind of knowledge, I'm praying I will continue to make good choices to prevent inflammation caused by poor food choices. And
amen to that. And I'm going to ask our, oh my gosh, she wears so many hats. Andrea Harrison was the chair of the council at Prince George's County for years, and now a delegate in our district in Prince George's County. She's the reason that Global Vision Community Health Center is still open today to cater to the needs of the underserved of Prince George's County. And I am so blessed to have you again on the forum again tonight. Thank you for your question.
Good evening, Dr. O and everyone, and I apologize that I joined late. Yes, I've been reading this book. Thank you so much, Dr. O. I love Dr. O, and if she says that anyone else is wonderful, I believe her because I have that much faith in Dr. O. But I was just saying, I've been reading this book, and it's not an easy read for me, but nonetheless, I am continuing to read it, trying to really get an understanding of, you know, the role of inflammation and how everything, well, choices lead to, you know, various issues, and inflammation often is the outcome of it, whether it's good or bad. And many times we see it as bad with the issues of high blood pressure, diabetes, and all of those other wonderful things. And so as I get older, I'm trying to operate in wisdom and just trying to learn as much as I can and do the right things for myself, because I want to stay around to hang out with Dr. O until we're 175 years old.
Amen. In excellent health. In excellent health. Thank you.
Thank you.
So the last question on strep, you know, for a minute, I asked Demi to, you know, repeat that question. Actually, it is true. There is a rare complication, glomerulonephritis can occur that is a complication of strep throat. It can occur, but that is not a part of prevention. That is an infection. There's not much one can do with that. I mean, we maintain good hand washing, we maintain good hygiene. I mentioned that when I was presenting in the adolescent section. I mean, that carries on over that we should maintain good hygiene. But, you know, bacterial infection do occur, and that's a rare complication that can occur. Thank you, Demi.
There's a question we can add to that. It says, what is the difference between gastritis and stomach ulcer?
Well, again, gastritis is an inflammation of the stomach, and stomach ulcer can occur. Chicken or the egg, which one came first? There's a bug in the stomach called H. pylori that can also cause ulcer. It can cause inflammation. It can cause ulcer. So ulcer, when we talk about ulcer, it's a sore. It's an open wound. It's open, and gastritis is an inflammation that can result in open wound or not. It can be open, it may not be open. So it depends on the gravity of the process that the patient has that would dictate if they have gastritis or they have stomach ulcer.
One more question, say from Ephraim and Hannah. So when we bury our feelings, we bury who we are. COVID-19 almost in our rear view. What can we do to help our young ones to stay mentally healthy?
That's a loaded one. What about even us adults? What can we do to stay healthy in this time? I think, continuing to socialize through Zoom, FaceTiming, not necessarily physical presence. Exercising is very important. I know people who didn't want to get out of their homes at all. And, when they FaceTime me and say they've not been out of their house in a month or something, I recommend that they actually exercise in their house, maybe going up and down the stairs for 30 minutes, or take the longest, area in their house that has the most length, and go back and forth for 30 minutes a day to exercise. I think this question is very important, Hannah, because having children sit in front of computers and gadgets is definitely not the way to go, especially during this time. We have to institute exercise. We have to get them out there. They need to spend more time outside, hitting balls or just running around the house, their perimeter, their premises. We need to get them to be active, and we need to engage them. Remember when I was talking about, the health of our adolescents and young adults. Connecting with them is very important. Letting them know how much we love them, spending time with them, giving time to them. There's no time like now when, things are standstill. We have to help them to alleviate the fear of COVID. We have to assist to let them know that we are there for them. Not necessarily to, lie that we are not, we don't feel a sense of anxiety about the virus, but that we are together and we will get through it together and we will be safe. We need to be there for them to do that, and we need to do it together. Sometimes those children even help us more than we can fathom if we allow them in and just connect with them. So I think connecting with them and exercising with them, playing games with them, those family time games, and not everybody sitting on their phones or on the computer, I think would be ways to help with mental health in these times.
Thank you, Dr. O. There's another question, says, are there benefits to breastfeeding a child until the age of 5? And what's the normal amount of time for mothers to breastfeed?
Ouch. So we recommend that women breastfeed as long as possible, definitely over a year. Research has shown that breastfed children actually develop great intellect. It makes them smarter. They have higher IQs when you breastfeed them. Medicine did not define age per se, But I know that in Africa, women breastfeed their children till they get pregnant with the next one. It's when they know that, they're pregnant with the next one that they stop. And children do fantastic. They come out with amazing IQs. So, but I don't know if you should breastfeed till 5. That is, ouch.
All right. We almost approaching the hour mark. Thank you so much, Dr. O. I think we still have time for a medical moment of inspiration.
Yes. And there is a question in here from Mr. Opeyemi that says that some diseases are autoimmune. Kindly highlight on the general preventive measures for them. Oh, wow. That's not my question. I'm a pure allopath. Dr. Ashby, you are a blessing tonight. Can you answer that question on autoimmune diseases? I learned a lot about that last night, actually, and how that actually can be prevented or
Yes.
mitigated.
Yes, indeed, autoimmune diseases are on the rise as well. And it's because of a lot of the cross-reactivity of antibodies that we produce against food items and environmental items that then turn around and attack some parts of our bodies. So one of the first places, if you're looking for prevention of autoimmune type disease, is to look at environmental factors like food that ends up inside of us or toxin that ends up on us or in our organs. Gluten sensitivity, even if it's not an allergy proper, has been the reason for a lot of people developing autoimmune conditions. So if you find yourself not tolerating some foods, it's good to pay attention to it. And there are tests out there that can tell you whether you have some sensitivity to foods or even allergies. And that would be a great place to start. So looking at the environmental factors, especially food, can be a great starter.
Fantastic. Thank you so much. And
hello.
Yes. Oh, Dr. Jagbe, welcome back, sir.
Yes. What I was trying to comment on was about the breastfeeding, jaw development, and sleep disordered breathing. So I don't know if you are rounding up. Do I still have time to make such comments or no?
Go ahead, sir.
Okay. Breastfeeding in the past, in different cultures, contributed to the proper development of the jaws of the infants as they grow daily and up to the adulthood, as they transition from breastfeeding to relatively firm diet to hard diet as they grow older. But as we can notice from the marketing and what we see, in the Western world, that there is a new trend. I mean, there has been a new trend for decades now, and the trend has been that breastfeeding has not been, adhered to in most of the advanced culture, whereby the babies are subjected to the bottle feeding, and from bottle feeding to the soft baby food in the jars. Sometimes the parents actually make their own mush for their baby by grinding the food down. Over time, these babies don't eat as firm or hard foods as they should. And so this affects the development of the jaws. If you look around you, you will see that there are many people that are using braces. So the part of the main problem is the fact that for children that are on soft diets perpetually, the jaws will be underdeveloped. Now, many of the babies that are born also have some, developmental abnormalities intrinsic at the level of the development of the tongue, whereby the tongue is attached to the floor of the mouth without being able to move properly. Now, all of these observations contribute to the lack of maximum development of the jaws. Now, the tongue is very, very vital in the development of the jaws. And if the tongue is tied to the floor of the mouth, definitely the baby is not going to be able to suck the baby bottle properly. The mother's breast will have helped if the child is allowed to breastfeed, from birth. So some of these things need to be, looked into as the baby is born and brought to the clinic, the neonatal clinic, as well as pediatric clinics, to see if there is a normal development of the jaw or the jaws. Now, if the nutrition or the dietary, modality is so soft, the jaws will not be stimulated to form properly. And that is one of the reasons why there is an epidemic of underdevelopment of the jaws all over the Western world. Hence the advancement and the ubiquity of braces. As you look around, you see many children in braces. What we need to do is to improve the diet of our children. For those who are, at the stage of childbearing or child rearing, my suggestion or my recommendation is that the mother should endeavor to breastfeed their babies. There are many benefits to that, but more importantly is the development of the jaws. Now, if the jaws are properly developed, there will be no problem with crowding of the teeth, and there will be no need for braces. More importantly, other than the fact that the teeth are crowded, is the development of the airways. The airway restriction due to underdevelopment of the jaws is more dangerous than the crowding of the teeth. So, for most people who have restricted upper airway, they end up being mouth breathers, and mouth breathers will end up with infection of the adenoids, infection of the tonsils, and they will further have respiratory restrictions even at the level of the oropharynx. So these are the reasons why we must keep, be very attentive about how the babies are fed, from breastfeeding to relatively farmer food that the babies can chew on, not just try to swallow the mush. They must try, even when they don't have any teeth, they should try to chew on stuff. They don't have to be hard like adults' food, but at least something firm enough for them to be able to chew on. The vibration of chewing actually causes the stimulation of the stem cells at the joints between the maxillary house as well as the mandibular joints. So we have to bear this in mind. I just wanted to address those. I know there will be time for us to talk more about that because the time is fast spent today. Thank you very much for the opportunity to share that.
Thank you. So question to you, Dr. Jagbe, should women breastfeed for 5 years?
No, actually, the breastfeeding should be between 18 months to 2 years. I know for some people that doesn't make sense because of the nature of their profession. But putting milk in, using the milk, the breast pump and storing milk is not the same thing as actually the baby nursing on the mother's breast. The resistance from the mother's breast is what causes the jaw and the tongue to develop properly.
Okay, thank you very much, sir. Appreciate you.
All right, now to our final question, and from Adenuga, says a friend of mine has bilateral blocked fallopian, and she was advised for tubal flushing. Do you have any advice for us?
Yeah, I would suggest that the friend takes the advice of the GYN, the experts. If by testing they see that the tubes can still be opened, that's the choice they will go for first. Or if at least one tube can be opened, they would go for that first before any other intervention.
Thank you so much, Dr. O. It's now time for Dr. O's medical moment of inspiration.
Thank you so much. I have an amazing medical moment this week. You know, I've always said it, I'm sure you've heard me say this on this forum, that God is the only physician. But he uses tools like us when he chooses to. Because he can just decide this thing is gone and it's gone. So it's a privilege for us to be used by him. This week, the Lord intervened in my brother's life, Ephraim, and Ephraim is still here today, and I glorify God for that. The Lord showed up and gave us a miracle like he did Lazarus. That is a medical moment. Doctors are still looking to see what happened there. So I just want to glorify God. I praise God for your life, bro. We still have a lot to do. Like your wife said, you still have a lot to do together. Glory be to God.
I'm back here.
Yes, you are back here.
Check back in.
Wow. I just heard his voice. Glory be to God. I thank God for you.
Yeah.
I cannot glorify God enough. And this week's award also goes to Ephraim and Hannah. It's going to be an Amazon gift card, and they won. If you bring in 10 or more guests to Medical Mondays, you do get a gift. Just email mmwithdr.O @gmail.com or MedicalMondayswithDr.O @gmail.com to let us know that you brought 10 or more guests and you will be our award winner for the week. And that being said, we are having Medical Mondays next week, the 26th. Medical Mondays goes on. By popular demand, we cannot take days off. We will continue to have Medical Mondays every Monday, and next week, Monday, stay tuned. Come back for more medical education, more medical knowledge to take us all a space further. So we will be meeting again next week, July 26th.
And that sums it up for today. Thank you so much, Dr. O. We are grateful to you, Dr. Ajagbe and Dr. Ash B, for your contribution. We say kudos to all of you who participated. We continue to educate, inspire, and empower you and give you medical information and more. that includes fitness, nutrition, and everything you need concerning your health. It's been a very good and engaging conversation that we had today. Remember to share the Medical Mondays link and invite your friends and family to join us. Remember that the channel for YouTube is Medical Mondays with Dr. O. On Facebook, it's the Medical Mondays with Dr. O. Don't forget to email us your questions and we will get them answered. The email is medicalmondaysdro@gmail.com. Remember to subscribe to our YouTube channel and hit the notification bell so that whatever information and whenever videos are uploaded, you will be first to get it. Remember, stay strong, strong health, strong future. Till we meet again, same time next week. My name is Gustav, and we say thank you so much to Dr. Toyin Opesanmi. Good night.
Thank you so much. Good night.
Good
See
night.
you next week. Good night,
next week.
everybody. See you.
Good night.